Hello and welcome to Hope Channel Kenya, where we bring light into the family. And this is another episode of The First Aider. Thank you for tuning into our channel. I'm your host, Sally Oriko. And with me is our resident First Aider and volunteer First Aider with St. John Ambulance Kenya, Moniki Mugaka. Yes, and later on in the show, we'll have one of our volunteers who will be aiding us in the demonstrations of this first aid, and his name is Edwin. So today we are talking about breathing and disorders of the airway, yes? And we already learned about what it is to be a first aider and the things we need to know about the basics of first aid. So when it comes to breathing, what are the important things as a first aider we need to understand about how to administer first aid to someone with difficulty in breathing?
Thank you, Sally. Breathing is the engine of your body. So if we are going to have any disorders, hence the reason why we have referred it to disorders of the airway and breathing. As a first aider, any other time that you are managing any incident, some of the key things that you are concerned about your casualty is their state of breathing. That's the first thing you will check. So what are these disorders of the airway and breathing? These are those particular conditions that can hinder or inhibit the well-functioning of the breathing process of the casualty. So some of the disorders are like choking. We have asthma. There is hanging and strangling. There is drowning. And there is hypoxia. Those are some of the disorders of the airway and breathing. So specifically, if we can highlight each of those particular disorders. Choking. What is choking? We need to go about like the definition of choking, how you will be able to tell that someone is choking, and what you can do as a first aider to help that person who is choking. So choking in terms of definition is partial or complete obstruction of the airway. That is what we can refer to as choking. Number two, we mentioned about asthma. Asthma is the massive allergic reaction along the airway, strictly. That massive allergic reaction is taking place along the airway. So that is the definition of asthma. We have triggers of asthma. As a first aider, at home, you should be able to know what triggers or what particular trigger has led to the asthma attack of that particular casualty that you are handling. We have triggers like dust, cold, exercise, and many others. Like I've said, cold, dust, exercise, strong perfumes, and pollen grains. All those can be triggers. And a casualty is not going to experience all these triggers at the same time. It's one or two which are going to be casualty specific. There's the third disorder of the airway and breathing we talked about, hypoxia. Hypoxia is that state where there is less oxygen in supply within your blood system. So we look at the conditions which can lead to the state of having less O2 in your bloodstream. So that is what, looking at it that way, it means that even choking, asthma, hanging and strangling are still part lead to the state of hypoxia. Drowning. Maybe the last disorder that we're going to look at under disorders of the airway and breathing. I'd prefer to call it half drowning. Because we are talking about drowning, basically we may not be having the casualty there to help. The casualty may have passed on. So half drowning is that state whereby liquid gets its way to your lungs. Instead of going to the normal route to the body, it's redirected to your lungs. So you'll find yourself in a state of drowning, not really being immersed
necessarily
Yes.
in a
You
pool
can
or a
even,
lake or whatever.
yes, you can even drown in your own saliva. Yes.
Okay. So they could be different conditions, but all the similarity is there's a blockage, if I can call it that, of the airway.
Actually, they're affecting the well functioning of the airway.
Of the airway.
Yes, all of them.
So is it different for ages? Like, would you administer first aid the same way for a child or a toddler or an infant, the same way you would for an adult?
Not really. Not really. Like if we are talking about choking, which we're going to demonstrate shortly, the steps you're going to use may be the same, but you are going to use appropriate force depending on the age, the size of the casualty that you're dealing with. Yes.
Okay. Well, we shall then demonstrate for us, Manik will demonstrate for us what we need to do when it comes to choking and how to administer first aid to someone who has obstruction of the airway. And please, I would like to put a notice out there to our viewers. This is for demonstration purposes. Do not try this at home, especially if your children are watching this. Please be in the presence of an adult. Yes? So, what do we need to do when someone is choking?
Okay. Sally, choking kills. And we have had many cases where actually choking has killed. So we need this skill, and we need to be on top of the game when you're dealing with a casualty who is choking. So what happens when we're dealing with a casualty who is choking? There are two steps when you're handling a choking casualty. The very first step is to find out the state of the choking. Is it a partial obstruction of the airway, or is it a complete obstruction of the airway? How do you find out this? You literally ask the casualty whether the casualty is choking. Sally, are you choking? The casualty will be able to either answer you, yes, I'm choking, or just show you by a sign that for sure I'm choking, but I'm not able to speak. So at this point, I will invite in our casualty, Edwin, so that we can be able to demonstrate the state or the condition or the disorder of choking. Okay. So if you come across a casualty who is choking, if you keenly look at a casualty who is choking, you should be able to tell some specific signs of a casualty who is choking. One, there's this universal sign of choking where the casualty is grasping the neck and pointing to the mouth where the problem actually is. If this takes some time, you will start seeing that the eyes of the casualty are popping out. Saliva will be pouring out. With time, again, the eyes will be having the tears running down, struggling to breathe, the coughing is there, and all those. So those are clear signs of a casualty who is choking. So as a first aider, what are you supposed to do at that particular point? So for you to be able to know the state of the choking, ask the casualty, Edwin, are you choking? At the first instance, Edwin has just tried saying, yes, I'm choking. It's a partial obstruction of the airway. So you encourage the casualty to choke. Edwin, can you cough? Try to take it out. Do it again. It's not coming out. Meaning that the obstruction is a bit, it's almost blocking the entire airway. So you need to move in and offer the practical steps of helping the casualty who is choking. And we have two key steps, the back blows and the abdominal thrust. You have to perform up to 5 back blows, up to 5 abdominal thrust. Not 5 back blows, not 5 abdominal thrust, but up to 5 back blows and up to 5 abdominal thrust. So what you need to do, move next to the casualty, have your hand at the chest of the casualty, let the casualty lean forward and open the airway. In between the shoulder blades, you're going to apply your back blows, up to 5. 1, 2, 3, 4, 5. It's not coming out. Very fast, go to step 2. Have your leg in between the casualty, tuck in your thumb, have it at the navel, kitovu, then interlock that. You're going to scoop up to 5. 1, 2, 3, 4, 5. The obstruction is not coming out. That makes it 1 cycle. You go to the second cycle again, doing the same steps. Up to 5 back blows. Up to 5 abdominal thrust. If it doesn't come out the second cycle, you go the third cycle. If by the time it's the third cycle and the obstruction is not coming out, chances are very high that your casualty could have done what? Chances are very high that the casualty will have fallen down completely. The casualty is not breathing. Hence the reason why I was having my leg in between, I will aid the casualty falling down. Now you will deal with that casualty as a casualty who is unconscious, and most likely, if you check his breathing, he may not be breathing. So you have a specific procedure on how to deal with unconscious and not breathing casualty. Are we together? Yes. Thank you, Edwin.
Thank you, Edwin. So is it the same process for when dealing with someone who has asthma?
Not really. There's something small on the choking bit that we need to clear. Remember, that is choking for an adult. You can be dealing with an infant. So how do you handle an infant? Is there anything special or different? Is there a different way of dealing with an infant casualty? And an infant in this case is 0 to 12 months. Yes, partially there is. You'll be holding the infant, of course, in your arms. The infant, turn the head down, hold the neck, try to open the airway. Use your fingers in between the shoulder blades. Then you'll be able to apply the back blows up to 5. You'll turn the infant to face you, but now you're not going to perform the abdominal thrust. You're performing the chest thrust up to 5 as well. Checking whether the obstruction is coming out, then you scoop it
out of the infant. So for an infant, it's not a back blow, but
it is a back blow, but you're using
with your fingers.
Yes.
With your fingers. And for an adult, it's a full palm.
Yes.
Back blow. So there's a difference between the ages.
Yes.
Okay. So how do we deal with someone who has asthma?
Asthma, as we mentioned in our opening discussion, asthma is that massive allergic reaction along the airway. So what you need to find out the trigger, because asthma is triggered. What might have triggered this particular attack? Is it the dust? Is it that it's very cold? Is it that somebody who has a very strong perfume or scent was just within the vicinity? Or is it pollen grains? Maybe you are back in the rural home where the plantation of maize is at that stage, where now they are flowering and the pollen grains are all over. So once you're able to find out the trigger of that particular attack, you do the necessary. And the necessary is to make sure that you either take the trigger away from the casualty if it's possible, or relocate the casualty away from the trigger. And in most cases, at this particular point, you may have found the casualty exhibiting a few signs, which even led you to suspect that the casualty is having an asthma attack. 1, there is a lot of coughing. Number 2, there is wheezing sound. When the casualty is breathing out, that's when the wheezing sound is coming out. With that particular sign, that is a clear confirmation that this casualty is suffering from asthma. At the same time, you may find that the casualty has inhalers. When you are doing your assessment, you came across the casualty having an inhaler. And you also need to remember this point. We have 2 types of inhalers so that you don't confuse which is which to be used at that particular time. We have, and they're differentiated by the color of their cap, the kifuniko on top. There's a blue capped inhaler and there's a pink capped inhaler. A blue capped inhaler is used as curative, and a pink capped inhaler is preventive. Meaning, you have this particular disorder or condition for that matter, and you know your triggers. You can have 1 or 2 triggers, not more than that. So if you anticipate coming into contact with that particular trigger, you are supposed to ensure that you prevent the attack by taking the path of that preventive inhaler. So on the scene, if you found a casualty already having an attack, you are not going to use the pink capped inhaler. You will concentrate on the blue capped inhaler which is curative. And if you are keen enough as a first aider, you will find this casualty in a specific position, even trying to portray to you that they are struggling to breathe. They will be such a way in a position that they're trying to open their arms, give room for their lungs, because you see now the airway is narrowing because of that massive allergic reaction. So that whatever little air is getting in, the inhalation and exhalation process can take place to sustain the breathing of that particular casualty. So in that comfortable position, that is what we call the treatment position of a casualty who is having an asthma attack. So when you're going to put them at a resting place, ensure that they are seated in a way that their chest is open, their arms are open, and in a comfortable. If you get a chair, make sure that the arms rests on the chair. Yes, on a desk or a chair. And now that their chest is wide open. In this position, if they have an inhaler, take it out, shake it for them. Once you shake it for them, and this casualty, remember, is conscious because you're able to talk with the casualty. So you should let them administer the inhaler themselves because they know the exact amount or how they're pressing it. So shake it for them, help in shaking it for them, give it to them, they will administer that particular puff. Within a minute or so, the airway will clear, the swelling will start going away, and the breathing process will start coming back to normal. Monitor the casualty nicely, but after they have regained, consistently advise the casualty to seek medical attention because chances are very high, maybe if they are taken the preventive inhaler and maybe its strength is lessening, it's not helping them anymore, or maybe they missed some medications, or they need the condition has gone to another level, so they need to be given a better medication. But at the same time, you may come across casualties who even don't know that they have asthma. It's their first attack, so they don't even have inhalers. So what are you supposed to do? The process is the same. Get them out of the trigger because most likely the trigger will be within the vicinity. Take them to a comfortable place. Put them in that treatment position that we have talked about. They're seated, leaning forward, opening their arms and raising and opening their airway. Tell them to breathe calmly, slowly, guide their breathing. Breathe in, out, so that you control their breathing. Because at that moment, they're breathing very fast. Just calm it down by controlling their breathing. With time, once they regain, you only advise them to go to hospital so that they can get the right medication. Mm-hmm. Yes.
So, okay, that is for asthma. So, on to the next one, hypoxia. How do we treat hypoxia?
Hypoxia, as we mentioned in our opening discussion, hypoxia is that state where you may be having less of O2 in your blood system. So what are the conditions that can lead to that? One, Sometimes when we board aeroplanes, do we experience something like hypoxia? If you have a jiko in your house, the carbon monoxide, what does it do to you? It takes up what?
The oxygen.
Yes, so that you will be in that state of hypoxia. Even what we have talked about choking, it's actually putting you in the state of hypoxia because it's narrowing or it's obstructing the airway, so less of O2 is getting in. So the disorder of hypoxia takes a broader aspect. So you only need to identify what state or what condition at that particular moment is troubling your casualty so that you can free them from that particular condition so that you can enhance the intake of oxygen. So issues like choking will lead to hypoxia. Issues like asthma will lead to hypoxia. Issues like drowning, because they are going to impair the functioning of the lungs, they will still lead to a state of hypoxia. Hanging and strangling, kunyonga, the same thing, it will lead to the state of hypoxia. So sorting out that, you are sorting out the state of hypoxia.
So hypoxia is at the state at which there's not enough oxygen coming into your body and you need more of that oxygen. So you talked about half drowning. Yes. So what do we do in cases of half drowning, whether someone drowned in a pool or, like you had mentioned earlier, in your own saliva? How do we administer first aid to someone who's half drowning?
Okay. Let's assume as a family you've gone out for a Sunday afternoon, you want to enjoy in the swimming pool. All of a sudden, you take your concentration away from your kids. The next minute, the kid has half drowned. In the pool, you don't even know how to swim. Where do you start from? There are no lifesavers there. So how do you go about it? The first thing we need to understand, if you are not a lifesaver, do not attempt to get into the swimming pool. Do not attempt to get into the river. For some of us who used to swim in the rivers back in the village, do not attempt to do that. Because what will happen to your casualty at that particular moment, the casualty will get into the water. And the reason why the casualty is actually half drowning, because he's very stiff. He's not relaxed. So he will take in the water to the point that once he has taken, let me say, enough of the water, the guy will be unconscious. And as we know, an unconscious state, your body muscles relax. This guy will float. So he'll be on top of. Now we're talking in the case of where you are not a lifesaver. The guy will float. In fact, even if you pick even a stick and pull the guy, he'll come all the way to the... Yes. Then now you drag the casualty out of the pool. And there's a specific way that you need to drag the casualty out of the pool. Make sure that the casualty is in front of you. Hold the casualty beneath the arms. Then now, holding the arms, then drag the casualty out. Now you have a classical case of a casualty who is unconscious and most likely breathing. Now, as a first aider, what needs to come into your mind is, how do I manage a casualty who is unconscious and breathing? This is a casualty who is supposed to be placed in a position we refer to recovery position, which we need, of course, another demonstration on its own. But the reason why you will place this casualty in the recovery position is to ensure that in the recovery position, the airway of this casualty is open. So the water or any discharge coming out of the casualty's body will easily flow out, and the airway will be retained open. But if you're a lifesaver, definitely you will dive into the water, get hold of the casualty, and swim with the casualty to the shore and take the casualty out of the water, then follow the same procedures, which I know we are going to discuss in our next discussion on handling a casualty who is unconscious and breathing.
So when it comes to these different procedures that a first aid must administer to a conscious casualty and an unconscious casualty, and there's different things one person needs to know about both and handling both. Well, thank you, viewer, for tuning into Hope Channel Kenya, and thank you, Maniki, for engaging us in how to administer first aid to a casualty who has difficulty in breathing. We would like to remind our viewers that the demonstrations here on this show are purposely for demonstrating and showing you what it is you need to do as a first aider. Please do not try this at home unless it is absolutely necessary. The emergency numbers for all the relevant hospital and police and fire brigade and St. John ambulance will be on your screen, and feel free to call them when necessary. Thank you, Maniki, for tuning in, and thank you for viewing. I've been your host, Sally Rico. Until next time, be safe and God bless.